Washington, D.C., our nation's capital. The iconic images speak to its place as a seat of power. But Washington is also a diverse community of real people with very real needs. From outstanding primary care, including dental services, to HIV and STD testing, counseling, legal assistance, and so much more, Whitman-Walker Health continues to provide essential services to the Washington, D.C. community. What started nearly 40 years ago with a dedicated few committed to battling discrimination and providing STD services to gay men grew to become Whitman-Walker Clinic, a leader in the fight against HIV/AIDS.
We learned quickly how to build programs, build services, make them efficient and effective, get the money necessary to do all of that. And so it was a combination of true compassion with, I think, a lot of talent.
Our community's response throughout the 1980s and early 1990s to the HIV epidemic is not only an important model for how you fight an epidemic, but it's an important model for how you care for people in your communities.
Today, Whitman-Walker Health is a nationally and internationally renowned high-quality community health center.
We are federally recognized as providing high quality and comprehensive care to the entire community.
The services provided by Whitman-Walker Health not only reflect the highest quality care, but are available to everyone in our diverse urban community.
Our guiding principles steadfastly remain excellence and compassion in care. We care for every and anyone who comes to us in need of health care. No one is turned away. We care for them regardless of their ability to pay, whether on public assistance, fully insured, or somewhere in between. We care for them whether their need is big or small. We care.
The nurse came in and she said, honey, they took a rapid HIV test and it's come back positive.
The doctor came in with the one single sheet of paper and here's your lab results.
Right.
And that was all he said. He actually turned and walked away.
A friend of ours works at Whitman-Walker, and Jeff was on the phone, and he had the phone like this, and he was holding my lab results, and he was reading them off, and on the other end of the phone, we were getting the information that no one else was giving us. They were explaining what everything was, and in some cases, the voice at the other end of the phone was anticipating what the next lab line was. It was incredible.
It was really that phone call that he talked me through the numbers, and he made me realize that there were people out there.
And he gave us the hope and the confidence that you get from someone that you know is an expert.
It seems like every time we have reached out someplace for help, there's been some association back to Whitman-Walker.
For us here at Whitman-Walker Health, it's all about our patients. Our employees and volunteers are extremely dedicated to our patients and to the pursuit of helping them live healthy lives. We're one community, and we're committed to the quest for quality.
Whitman-Walker was founded because of discrimination and stigma. Whitman-Walker was evolved as a way to meet the needs of people who were afraid to get to the doctor, who were afraid to get health care.
I want our patients to know that this is a welcoming and affirming place, that our employees and our volunteers have an open heart and mind.
Over 85,000 times a year, Whitman-Walker's door opens to care for someone in need in the D.C. community. We could not do this without you. You who by your time, your heart, your goodwill, and your financial support help to create Whitman-Walker, help to guide Whitman-Walker, and today help fuel Whitman-Walker's efforts and provide us with stability, leadership, and vision as we look to the future. Thank you. Thank you for being part of this journey. Thank you for making Whitman-Walker Health a shining example of what the power of community, the power of caring, can do.